All right, good afternoon, everybody. It is about 4:03, and I think we're going to get started. My name is Lisa Torres, and I am the chair of the Charlottesville City School Board. I want to welcome everybody. Thank you for joining us. This is a first of what we hope to be a series of opportunities to receive questions and provide information and answers to questions that we've received to our community, specifically about how we are working to create COVID-safe schools. Before we get started, I do want to acknowledge and state that we have nearly 200 Afghan and Afghan American children in our schools. And I want to let y'all know that we stand in solidarity with you and your families through this difficult time. Thank you. I do also want to thank everybody in the community who is stepping up to support these families and new families as they join our community here in Charlottesville. Again, thank you everybody who's tuning in to join us. I do want to let you know that as a parent, as the school board chair, as a healthcare provider in our community, I value everybody's opinion. We value your concerns and your questions. We're here to receive those questions, and I do want to emphasize that we at Charlottesville City Schools have worked hard. We have partnered with health experts in the community, other leaders throughout the state to receive information, and we've worked hard the last 18 months with our COVID committee and all of the information and data that's out there to put in place and to ready our schools to move forward and to welcome our students back into the buildings. It's a priority of ours to follow science and to promote safety in our schools and to promote safety for our students and our staff. So with that being said, I do want to welcome and send thanks or express my thanks to our moderator, Charlene Green, who is Deputy Director of Piedmont Housing Alliance and a local leader in equity and civic engagement. So Charlene, welcome, and I will turn it over to you.
Thank you very much, Lisa. I want to welcome all the families here this afternoon. We have close to 100 folks who are on this Zoom call. And so thank you for taking the time to be here with the Charlottesville City staff, City School staff. We're looking forward to answering the questions that have been submitted and any questions that you feel like you haven't heard a response to. You have an opportunity to submit those in the Q&A. So please do so if you haven't heard anything that scratches that itch you might have about this particular topic. So here's how we're going to do this. We're going to first hear the big picture on the school's approach to COVID safety. And that will be from our two panelists tonight, who are two members of the senior staff of Charlottesville City Schools, who lead the COVID safety efforts. That's Kim Powell, who is the Assistant Superintendent of Finance and Operations, and Dr. Beth Baptist, Acting Director of Human Resources and Student Services. So they're going to be answering the questions that you've submitted and try their best to give you the picture of what the schools are doing. In response to questions that have been received, they're going to also talk about how the schools are proactively promoting COVID safety, and then how the schools will respond when there is a positive case that the schools will have to deal with. So with that said, we're going to get started. And the first question is, why is it still the right plan to have most students in person?
Charlene, I'll take that one.
Okay.
So really, when you think about this question, at least for me, I think there are three big reasons why this is the right thing to do. One is our experiences this past school year, both here and in the surrounding areas. Those experiences show us that we can do this safely for our students, because most of that experience, remember, was before the vaccine. And school operations were very successful in keeping students safe even before there was any vaccine in our community. Secondly, both the CDC and pediatricians nationally, no matter what area of the country, even in areas that have been pretty hard hit by the Delta variant and the surges, if you will, even in those areas, the pediatricians are saying it's best for students to be back in school. So it's just simply that important for the overall health of our students in our community. And then last but not least, we really don't have a choice at this juncture. It's a mandate from the governor. So I think it's important that people understand that there's no decision to be made about whether or not we reopen for in-person. Beyond all the reasons that it's the right thing to do, we've proven that we can do this safely. It's also, at this point, it's mandated by the government. So we're very excited to have our students return in person for this school year.
All right, very good. So how has the division's thinking adapted since the Delta variant started making a big impact in the US in the past few weeks?
So the Delta variant really just tells us very clearly that we can't let our guard down, that all the things that we saw work this past year, we need to use what we've learned over the past year, use what the most current science and evidence shows us is effective. But it just simply means it's not a time to let our guard down.
Okay. What are circumstances in which an entire school or the whole division would go into quarantine or return to virtual school? I think that's a big question a lot of folks want to know about.
And I'll attempt to give you an answer for that one. We are closely monitoring the numbers every day for the cases that we have. And of course, once the students return on Wednesday, we'll be getting more information about student cases. We're in touch with the health department almost daily. And if our numbers start going to a significant number, and I don't really know what that significant percentage is at this point, but we would be working with the health department, and Dr. Bonds and her staff could help us decide if or when either a class needs to be closed or a school needs to be closed, or even the full school division. So we would need to look at the numbers of students, the numbers of staff, and we'll certainly do whatever the recommendation is from our local doctors and the health department. So there's not an exact answer for that, but I promise you we're looking at it very closely every day.
All right. So let's talk a little bit about some of the mitigation measures. Kim, give us a lay of the land on what is being done to promote COVID safety among students and staff.
So I think the number one tool that we have at our disposal for this school year for a good portion of our population is the vaccine. And I'm really happy to report that as of this moment, approximately 95% of our staff are fully vaccinated. And Dr. Baptist updated me just prior to us all getting on this Zoom that we have another 3% that will have had their first shot this coming week. So we're going to be going from 95, clearly embarking on 98% with this week ahead. So I was really excited to get that update from Dr. Baptist. Beyond the vaccine, one of the other key things to helping keep our whole community safe continues to be masking. I mean, the evidence from the experiences of the past year is saying that masking is simply one of the most important things we can do to help mitigate the spread of COVID. So also, we were really excited to learn last year that our students and our staff, of course, but also our students, they do a good job with masking. So we that's one of the things we saw, that we can do this, and we're excited to know that that's such an effective tool in controlling COVID. And then the third thing that I think is most critical in COVID mitigation is the ventilation systems. And now all of those improvements are in place. And I'll just recap those. I could talk about air handling for an hour, but we don't have that kind of time. So I'll try to summarize what the key pieces are of what we've done to improve both ventilation and what I call air sanitation. I don't know if that's exactly the right term for it, but anyway, all of the filter upgrades have been done to the highest MERV rating that they can hold. And that's dependent on what they call the size of the rack in the system. But every area that can accept, where the rack can accept a MERV 13 or 14 filter, they have MERV 13 and 14 filters. There are some areas where the equipment can only go up to a MERV 8, and those are now up to a MERV 8. They used to be at a lower level than that. But that's not all that's been done. We've also added HEPA filter units, standalone HEPA filtration units, and that's actually a standard above a MERV 13, 14. And those units are in all the classrooms, and we even have smaller units in offices and so forth. And then, so beyond the building system changes, beyond the HEPA filtration, we've also, with the city, put in the bipolar ionization equipment. And I was refreshing myself on how to explain what bipolar ionization is, but it effectively deactivates it. It works at the atomic level, and it sort of deactivates the molecules, with sort of killing the virus, if you will. And I know that's not the right technical term, but if you want to look up bipolar ionization, it's a whole other type of tool that we're bringing to bear besides ventilation to actually disinfect or sanitize the air. That's kind of the way I like to think of it. And then we also have the UVC lighting sanitation going on in areas where there's a sufficient duct work, where that makes sense, because there has to be so much contact time for the UVC lighting to effectively kill the virus. But wherever we have those links, which is typically in the areas like for common areas, gyms, cafeterias, in those areas, the UVC lighting, typically you have enough of a duct run where that lighting, that technology can be effective. And so that's all been installed. You know, we were kind of getting that all in as fast as we could during the spring. It's all in. Let me look and make sure I'm not forgetting anything else. Oh, the building automation systems. All of our schools have a building automation system, and they're being set for maximum outdoor air exchange, which is monitored through the levels of CO2 in a building. And so all of those adjustments have been made, and they're being maintained for maximum outdoor air exchange through the building automation system. So I think that's everything. But I'm excited that we're no longer waiting for equipment anymore. All those things are in place. So in summary, I think that for me, when I look at the science and what the CDC says, it all makes sense. It's vaccinations, it's masking, and it's ventilation measures, air handling measures. And we're prepared with all of those things to the extent possible. Of course, we don't have a vaccine yet for under 12, but we'll get there.
Right. So in keeping with that vaccination piece, where does the testing come in? Are you going to do random testing? What's going to happen with that? And either of you can respond to that.
Dr. Baptist, I think.
We're in conversation currently with a company to work with testing for us. Through the federal government, monies have come to the state governments and through Virginia Department of Health, who are working with the Virginia Department of Education and school divisions. So we are talking with a possible company that would come in and do the testing for us. They ran some pilot testing in the spring, and so they've kind of learned some more about it. This testing program would not start probably until about the 1st of October, but Virginia Department of Health would identify a vendor for us who would come in with their team, and they would do the testing. We would work with them to decide how we would do it as far as the randomization. We won't be testing everybody every time, but we would do a randomized sample, and we may do it a certain percentage at each school. We could do it a grade level. We could do whatever. We will have to get consent from families. So the only people who will be in the sample will be families that have given consent. And what they will do is what's called pooled testing. They will take probably somewhere between 5 and 10 students and do the test, and they will put the samples all together into one test. And then if it comes back negative, that means that all of the people in that sample were negative, and that would be the end of it for that round of testing. If if the sample came back positive, then that would mean somebody in that group or in that pool was positive. So then they would do individual testing on all of the people within that pool. So we are right now looking at what are we going to do to get the consents, what sort of schedule we want to do, who we want to work with us, and the actual VDH will provide funding for us to have someone who can do some of the coordination of it. So that won't be another duty with our nurses or our principals. So we're trying to get all of those details straight. And as soon as we have them organized and straight, we'll be sharing it with families so that we can get the consent from families for which children we would be using. And we could also be testing adults too. So it's not just children, it could be staff members. So it's an ongoing process right now, but we hope to have more details within the next 2 to 3 weeks.
So social distancing is a part of the plan, and trying to make sure that students are encouraged to keep apart as much as possible. How is that going to work with lunch and changing of classes and things like that?
So with physical distancing, it's been a little bit de-emphasized as far as the priority of the different mitigation measures, but it's still, it's still important. It's still a tool in the tool chest that we're going to use. And so all of the classrooms are being set up to maximize physical distancing as much as possible, beyond 3 feet where it's possible, and in other areas, right around that 3 feet. Again, if you're in a situation where you can't have a strict 3 feet, if you're at 2.5 feet, it just reinforces the importance of the other mitigation measures, the masking and the ventilation and so forth. But we're maximizing distance wherever possible. That includes on the playground. We're talking to staff about making sure that even when we're outdoors, maintaining distance as much as possible. So we still have all of our floor markers in place, furniture markers are in place. And when it comes to spacing and distancing, another thing that's important for us is assigned seating. There's still going to be a lot of assigned seating on buses, assigned seating in classrooms, because that comes into play for contact tracing. So that's something important for families to remember. That certainly is one of the things that we got used to from last year that's not going away. And then we are going to, with eating, because that's one of the more challenging areas, we are going to continue to eat in the classrooms. We're not bringing people for the lower levels, lower grade levels. We're going to continue to, do dining in classrooms where they can maintain the separation instead of at large tables. And then for the upper schools, Buford and CHS, we've gotten a lot of individual desks. So if you go in a cafeteria or one of the commons areas for dining, you don't see the big tables anymore. You see lots of individual desks spaced apart. And then outdoors, of course, for activities whenever possible. One thing, as Dr. Baptist was speaking about testing, I realized I completely forgot to mention that for our staff who, for whatever reasons, cannot be fully vaccinated, until they're fully vaccinated, they're subject to weekly testing. And that's separate from this pool testing program. That's a different thing that is part of our plan. And I think most people are probably aware of that because of the school board actions that were taken to validate that plan for the coming year. I just forgot that when I was talking about vaccinations earlier, sorry.
No problem. And what about the hand washing and all of the, I have several on my desk, the hand sanitizer piece.
Oh, yeah. So hand hygiene is still important, for lots of things, not just for COVID. We want to encourage good hand good hand hygiene. So we still have all the stickers and signage up to remind students. But the big thing is the hand sanitizer is going to still be readily available. And then those routines that we got into in the spring, where staff, depending on the classroom configurations and where sinks are available, that kind of determines whether students do more hand washing or more hand sanitizing. But it's sort of a part of how we operate now. Again, it's just part of what was put in place. And certainly the supply of hand sanitizer is something that my assistant and we still manage what we call our little COVID warehouse, and we're always replenishing supplies and to make sure that schools have the things they need, whether it's hand sanitizers or disposable masks or whatever. And that's just part of what we do now.
So Beth, let me reach out to you and ask you, do you see any questions there that might fall in this area of mitigation that Beth or Kim can answer for us?
I think one question that came up, one of the first questions that I've seen is there a point at which we might consider requiring vaccination for students as well as for staff? And I don't know if Beth Baptist wants to speak to this, but that's one of the first ones that came in.
That has not been mentioned yet. If that is something that our local physicians and health department would recommend, we would certainly entertain that. Vaccinations are now readily available to all of our students ages 12 and up. We held one vaccination clinic at the high school last spring that was also, well, it was for Walker and the high school, and we had one at Buford. We're getting ready to have another one September 3rd. But we have not talked about making it a requirement, but we will follow the guidance if that should come up.
Thank you.
And Dr. Baptist could correct me if I'm wrong on this, but I think there was some discussion with the health department on one of the weekly calls that until the vaccine moves off of EUA status, I think that, you know, it wouldn't be required. It would be actually, I think, a government decision, a decision above all of our heads as to whether or not it becomes a requirement for public.
Yeah, it has not become a requirement and likely won't become a requirement, you know, like we have the measles and all the different things we have for school entrance. If we get to the point where it is required as one of those, we certainly would honor that. But I don't think during this school year we will probably get to that point where it is absolutely required.
Okay. I know Kim mentioned the fact that as far as lunches, that especially at the younger grade levels, that schools are trying to get outside as much as possible. There was a question, and this is not exactly in our purview, but I just want to make sure it's not our policy. There was a question about the YMCA program saying that they had to have snacks inside. So there's nothing in our policy that would require that to be true. Is that true?
That's correct. And I would say that when it comes to the after school program now with the YMCA, they are subject to licensure requirements that I'm not an expert regarding. So I don't know if they have something that they are, when they respond to a question like that in a certain way, it may be through a lens of the licensure requirements that they're subject to. But I will say the YMCA was a great partner with us through virtual learning and really showed themselves to be very capable of providing a safe, consistent program for students. They ran the virtual learning center at Walker next door throughout the entirety of last year and were very successful with that. So,
okay. Another question came in about the masking policy. It's saying that there's some science saying it's possible to transmit the virus outside. So would there be reconsideration for requiring masks outside for students?
So the current, because the young students are not yet vaccinated, and you're talking primarily about recess and playground type situations here, my understanding, our elementary principals are going to have students masked outdoors, but there's also a general understanding that that's the best time to take a mask break when you're outdoors. So again, it goes back to being physically distanced if a student needs a mask break outside, but our students and staff are planning for them to be masked outdoors as well, with the understanding that when students are running and playing and if they want to take their mask off, that's just when that physical separation becomes more important.
Okay. And then I would like to clarify then, I do think probably that misunderstanding or that might be an example of where our website just may not be caught up with the elementary school's practice. And it's just an example of how I think we're going to err on the side of caution. And so I will work to make sure we get the website up to date on what the elementary schools are actually going to be practicing on that. Thanks,
Yeah,
thanks for asking that question.
And in defense of the website, I think that it's just the CDC guidance is not as strong on masking outdoors as what we're planning to do operationally.
Okay, thank you. While we're on the subject of testing, this one may not be the right place, but I might as well ask. People are asking if an at-home COVID test, now that they're available at home at CVS or other places, would that be an adequate proof for a child to return to school? If the doctor has said, just get a COVID test and show it to the school, would the at-home, it's not PCR, but would the at-home COVID test from CVS be adequate?
PCR is the standard. And we know last spring we had several false positives and false negatives with the rapid test. So we prefer the PCR, but if a doctor has given the direction to do one of the take homes, then we will help to follow with that guidance from a doctor. But the PCR is the one that we would prefer because it is more likely to be the accurate test.
Okay. Let's see, I'm just trying to skip down to the ones. There's a question just kind of reiterating that since classes are going to be larger this year, it's going to be harder to distance. Is there any kind of further comment that Kim or Beth would like to make on that, given the fact that we will have larger classroom sizes?
Well, last year the distancing guidelines were at 6 feet, and that has changed now for 3 feet. So within classrooms, outside it is still the standard is still 6 feet distance, but in classroom settings it's to 3 feet, and that was done to allow more students to be back in school, not by us but by CDC and Virginia Department of Health. So I think the principals are all working to try to help their teachers get the room set up so that we can have maximum distance at 3 feet. Contact tracing will be done for students at 3 feet. Interestingly, contact tracing for adults is still at 6 feet.
Okay. The last one is back to kind of the health department's guidance for us about when would we close an entire school or an entire district. I remember last year, the health department kept reiterating, look, we just can't give you a hard and fast rule because every circumstance is so different. It's just a matter of what we learn when we do the contact tracing about that circumstance. Is that still why you can't give a hard and fast answer for if we reach 5 cases, we'll close the building? Can you speak a little bit more about that, Beth?
I think it's just from what you said. I remember back when we had the H1N1 and we were closely monitoring the numbers there, and we talked about would there be a certain percentage. It's hard to say a certain percentage because you can have X number of people, which equates to a percentage with the virus, but asymptomatic and they're not sick. Or you may have a certain number where people are really sick. So we've got to look at, what is the condition? What are the numbers? Are these people who are not sick? Are these people who are now going to the hospital? Have they been vaccinated? Have they not been vaccinated? So there's so many factors now that I think it is going to be hard for the health department to help us. But you can bet I will be working with the health department if we see any school or classroom that goes over more than a couple to ask how they would recommend that we do it.
Another thing that comes to mind while you're talking is that if I remember correctly, in the spring, the cases that we saw really did not originate at the school. They originated at home. And then they, in many cases, before the child ever was able to come to school, the child was in isolation. And so I think that's another reason why just because you've had a situation reported at the school doesn't mean that it necessarily impacts the school.
Absolutely. Every case that we did contact tracing on last year, we did not find that anyone else who came down or had COVID had gotten it from anybody in school. You're right.
So let me, because I noticed some of the questions also are starting to ask, so what's going to be the school response? And this flows very well into the next question for you, Dr. Beth. So tell what can families expect when there is a positive case of COVID among students or staff?
When either I hear of a case from the health department or I hear from somebody in the school, I will contact the health department. They have contact tracers and we have gotten to be very close friends. We will have the conversation. We will try to get the details. If it was in school, how many students were around, how close were they, or even if it's an adult, get all of the details that we can. The health department will then do the contact tracing to see if any others need to be tested or what we need to do. And we will follow that advice. We will contact families if we're asked to make the contacts, or either the families often contact us and tell us what has been going on. Will we send out something to families if there is a case in a school? That really has not been decided yet. We have to be very careful with confidentiality. And just as if you have a case of chickenpox in school, we're very careful about how we make the notifications, again, because of confidentiality. But if it reaches a point that the folks at Blue Ridge tell us that we need to make those contacts, we will. We want to be as transparent as we can, but we do have to honor the confidentiality of the family or the staff member when we're working with these cases. Health Department has given us a flow chart, and I'll be sharing it with all of the schools this week to try to help us know the guidance of what to do. But everything is so different this year than it was last year. This year, that you have to ask, was the person vaccinated? And then that sort of takes you down one path. If they haven't been vaccinated or the people around them haven't been vaccinated, you go down a different path. So it's almost individualized how we will be responding to this, but we will get the information out to the people who need to know as quickly as we can, and will be as transparent as we can while still honoring confidentiality.
So
Excuse me, Charlene, do you mind if I speak to that for a quick moment?
No,
The only thing I would say as on the flow chart, it ultimately comes to, you know, when you look at the protocols about communications, the last line is for me to work with the health department to make that call. And the only thing I will say is last year, the way we handled that is if there was a case, we told first the immediate people who'd been exposed.
Mm-hmm.
And then I think in every case, we told the classroom in the most general terms possible, a student or a staff member, part of your classroom has been diagnosed. And then after we told the classroom, we told the entire school in the most general terms possible, a student or a staff member at your school has been exposed. And I think that worked very well last year to protect the confidentiality that Beth is talking about. But, and also I think it worked well because the very first people to learn were the people who needed to change their behavior in some way. And then after that, we just told people as a matter of transparency, moving away from the case to the whole school.
And in some cases, the person who has had COVID will say, please tell the people around me that I've had COVID. And so we've been able to share, but unless we have that consent, we won't be sharing individual names.
And so with the transparency piece said, so will there be some way for parents to find out online the number of cases that have been, you know, happening for each school as well as the entire school division?
Yes, ma'am. We have a dashboard that as soon as we get a COVID case identified, I add to the dashboard, and it's listed by what week, what ending Monday through Sunday, what school, and whether it was a staff member or a student. And Chuck may have to help us know the exact way to locate that, but that is updated as soon as we get any case. And we did that all through the school year last year.
And we decided to leave last year's dashboard up as well. So if you go to that Return to Learn page on the website, which is linked now and probably will be for the whole year on the home page, you can see both last year's dashboard and this year's dashboard, and you can link to the spreadsheets that kind of give the data underlying those graphs.
Mm-hmm.
So let's say we've got a student who has to be in quarantine, or a staff member, a teacher who may have to be in quarantine. How do they still continue their responsibilities? A student, for instance, with their learning, a teacher perhaps with their teaching responsibilities. Will any of that be, will there be options to do that online or virtually, or how will that work?
We do have a virtual option, but that is not answering what you're asking. If a student we know is going to be out for the full 14 days of a quarantine, we're asking the schools to make sure that the student has the work available then, or that parents can come in and get work during that time. So the work would be asynchronous likely. That's not to say that a teacher couldn't have a session with a student, but it would be primarily asynchronous. Same thing with teachers. If they are out because of a quarantine or an isolation, we would have a substitute in their classroom rather than them doing everything virtually. That doesn't mean they can't send things asynchronously or still be in touch with the students, but it would not automatically switch to a full virtual class setting unless we saw a need to do that down the line.
And the only thing I will say is that I've heard schools talk about how one of the learnings from last year is how to connect with students via tools like Canvas.
Yes.
And again, I think your point is that we're not going to just suddenly assign an in-person student to the virtual program.
Yeah.
just because they're out for a number of days. But some of the virtual tools that we learned last year have proven useful and will remain useful.
Yes, and all of the classes are in Canvas, so a teacher could help connect the family so that the child can keep up with the current content.
Beth, are you noticing any other questions under what happens in the school setting for any quarantine concerns, or because I noticed a number of good questions that I think we will definitely have time to go to. But I want to make sure under this topic, we're not missing anything.
I think one question that I think is basically if a family believes there's been an exposure or a diagnosis at home, how do they start the process of reporting contacts, and how do they let the school know what the school needs to know?
I would say contact the principal to give them the details of it, or either call the health department, either one, because they have the hotline for the health department to take in information. But if they call the school and the school contacts me, then I will be glad to call the health department, give them the details and make the connection between the family and the health department so they can get all of the details that I was talking about earlier and see what will be the best way of doing it. But as much information as a family could tell us when they contact us, it would make it easier. And the same questions I mentioned earlier: has the person been vaccinated? You know, when were they last in exposure? How are they feeling? Are they symptomatic, asymptomatic? And then that helps us know how to guide the family.
One question that I've seen in a couple of different ways is, you know, for a student who's not wearing a mask, how are you going to handle that? And I know every situation is different, so you don't have a hard and fast, like this is exactly how we're going to handle it for this exact student. But I'm wondering if one of you could speak to, I've heard colleagues say this is less of a discipline matter than a safety matter. And I'm wondering if one of you could kind of speak to that philosophical approach to mask wearing.
I can speak to that one because I've had a lot of conversations with principals about that. And one of the comparisons that I heard that really kind of resonated with me is, and this is an example from like the high school level, right? But they have, you know, at the high school level, there are certain expectations when you're in school, which is your, you know, no hoods up, and even something as simple as you need to wear shoes to school, right? That's a safety thing as much as anything else. You need to wear shoes to school. And so the high school team in particular, I had a long conversation with them about this, and they talked about how they handle it much like those types of, almost like a dress code violation, except it's even more important. This is safety. It's safety for the student themselves, and it's safety for everyone else around them. So I think, again, the really good news is we learned this past year that our students can do this. They'll slip up occasionally, but they can do this. And the staff have also proven out that they can have the conversations and the relationships with the students to help them comply with this important safety measure, again, for themselves and for everyone else around them. So we're encouraged by our past experience, and then having that mindset that it's not really a discipline matter as much as it is a safety matter. And it's not our first rodeo. So
another question that I've seen coming in is, could somebody just remind families a little bit about this screening, the health screening that all families agree to do and all staff members agree to do before we come to school?
Well, we do ask all families to check on the current status of their children. Are they feeling ill? Are they having runny noses, sore throats? Checking the temperature, things like that. And if any of those symptoms are present, headaches, there's a whole list of things. Any of those symptoms are present, don't come to school that day. You know, get the child checked out, or, you know, see further what is happening with the child, but don't send the child to school until we can get some sort of definitive answer. And that's what the doctors tell us too. They would rather see a child in their office for something that is very minor than to have the child come to school and then expose lots of other children possibly to COVID. So, and we ask our staff members to do that too. We have an attestation for all of our staff members that they will do their self-help check every day before they come to work. I have my thermometer in my pocketbook. I check my temperature coming to work every day. I'm sure people around me in the cars wonder what's hanging out of my mouth, but I check the temperature every day on the way.
Oh, sorry.
I was just going to say in the screening piece, I remember when schools went back to in person, I think it was earlier during the last school year, and the bus drivers or the staff on the bus would ask questions of the students as they got on. So will that still continue? Will there be a sort of a screening as kids go into the schools or into the, how often will the screening needs happen on a daily basis?
So we are not planning to screen when students board buses or when they enter the schools for this school year. That is a tool that we can bring back into effect anytime if needed. But it was one of those things that experience showed from last year. It really didn't catch much of anything. And it is a significant drain on resources and time when it comes to our bus routes and also just even getting kids into school and starting their learning day. So for those reasons, it's, with any given measure, we talked about all the layers of mitigation measures, and there's some that are clearly worth it, worth every penny, worth every minute, the must-dos. And then there are things where it's like, did this really help us out that much? Not so much, and yet it's a significant investment of resources. And so at this time, again, the CDC and so forth, in the early guidance, it was a big thing to screen when you got to school. You don't see any of that anymore in the guidance. And it's certainly a process that we know how to do if we have to reactivate those protocols. But for now, the much more important thing is for the self-screening to happen with our families and with us as individuals before we come to school.
I'd like to ask a follow-up because first of all, I just want to make sure everybody is starting to get their mailings about the calendar, and if you're staff members, that you've had access to the calendar and the screeners. But we did send home the latest screening guidance from the CDC, and I just want to clarify that because the question too has come in. It asks you both for your particular child, what symptoms is your particular child seeing, but it's also reminding you if there's anybody who's symptomatic in your house, then your unvaccinated children should also stay home. There's different guidance. The CDC has given different guidance for vaccinated children that they can continue on with their lives. And then as they get follow-up, they would get 3 to 5 days later, the current thinking is to get tested. But I just wanted to go ahead and clarify and also make sure that that those calendars are, if you haven't gotten a calendar by maybe the end of the week or whatever, and you want the screener, you want the calendar, feel free to reach out to your school because they have extra copies just for that situation if something happened in the mailing. And a magnet, and a magnet to keep it on the fridge, just as a daily reminder for the check before you leave for school.
There was another clarifying question I just saw about feeling like there should be a different response or a more informative response to what happens when a child is non-compliant when I would assume when they're not wanting to wear a mask or do any of the safety measures.
So certainly if a child is not being compliant and ultimately we exhaust all of our tools in our tool chest to help the student become compliant, they could be sent home from school. There would be discussions with families. I mean, all of those things would happen. But so we have plans for that if it does become necessary, because it is a safety matter. And I didn't mean to de-emphasize what those actions would be, but it's just anything else that's a serious safety. If you think about, again, just we don't allow children to not wear shoes in school, right? It's the same for the mask and what that looks like. It's going to be very individual. I would say that it's important that if a student has an accommodation where they cannot wear the mask for some reason, then we have face shields and other things that could be brought to bear that don't meet the same standard as a mask, but it is some barrier, some protection. So we would work with the family to work through a process to help the student get where they need to be able to comply. But certainly we're not just going to allow it to continue within the school, but we would make every effort to work it out at school. But the next level would be working with the family and so forth. And that could involve a student needing to be at home for a bit until things could be worked out. But that we didn't, I'm thankful to say, we didn't encounter that situation in the spring with the students that we were serving in person this past year. But we thought it through all the way to that level.
Right. Any special attention being given or being done differently for students with health issues?
So I mentioned briefly, like there could be accommodations with regards to a face shield versus a mask and what that, you know, different things like that. I'm not sure what else would be involved with that question. I don't want to miss the intent of the question.
Sure. It was specific to an immunocompromised student, someone who might have some sort of condition that when they're placed in a situation where there's a high level of potential disease or something contagious, is there anything that the city schools are going to do differently than what you have already been doing when that situation is in place?
I think in that case, it's really important that the parents work with they need to talk to the principal about the situation to see what other mitigation layers could be put in place. Everything from where the student is assigned their seat throughout the day in different scenarios, just making staff aware if it's a young child, helping the staff who need to know be aware of the particular importance of maintaining physical distancing, even perhaps when outside. You know, there are different things that could be worked out. It would be individual, but I think the main thing is just raising awareness with the principal of what the medical concerns are, and then allowing that partnership to take place between the family, their healthcare provider, and the school, because I'm sure the healthcare provider for that student could perhaps also weigh in with specific recommendations that I'm sure the school would be more than willing to, you know, put into practice. We have a great partnership with our pediatric community through all of this. Dr. Baptist is their main best friend. But I've seen firsthand how that partnership works, and I have every confidence that if the family is willing to open up that conversation, we could figure it out.
We would encourage the families too, if your child has known allergies, that maybe they don't even need treatment generally at school, let the school nurses know, because sometimes the allergies may mask as COVID. And, you know, if a child is having fall ragweed allergies or something, that doesn't mean we wouldn't do something as if it were like COVID, but it would help us if we know they've got allergies to start that conversation as to, is this allergies or is this something different? So, you know, we want to know what possibilities we might have with the children, not trying to dig into things that aren't any of our business, but what we can do to really help the children while they're there and make them even safer.
We have about 10 minutes left, and one question I see that is potentially along the lines of confidentiality. Someone wanted to know, is it possible to know how many classmates in a particular class are not vaccinated?
We don't know that information because we don't have access to the vaccinations for our students. We have asked about the vaccination status for our employees because of the procedure that the board approved at the August 5th meeting. But as far as students, since it's not required, we don't have the number of students who are vaccinated and who aren't. If parents want to give us that information, it can be in their child's record, but we cannot ask for that.
And I've seen a question come in that makes, first of all, I want to say there is some regional data that the health department will be publishing about. At this point, I think there's still some uncertainty about it, but according to at least the state's version of our local numbers, the youth vaccination rate is very, very high in Charlottesville and Albemarle. I think there's some maybe disconnect between the local numbers and the state numbers, but at least for the indicators we get from the state numbers is that it's very high. There's a question about vaccinations required for staff, and I just want Beth, if you could clarify again what the school board policy, or you know, just how teachers are responding, and give the vaccination rates one more time.
Okay, we've heard from approximately 700 of our employees, and of that number, all but 23 have already either fully vaccinated or have at least one of their shots. and others will be requesting either a medical or religious exemption, and realize if they're not fully vaccinated, they will have to submit to weekly PCR test, and we'll have to provide that documentation to us. So I think out of approximately 700, with knowing that that percentage is between 95 and 98, that's a great percentage. We'd love for it to be 100, but we know that some people are not able to get the vaccine. So, but the way the school board has done that, if someone is now sick with COVID and is vaccinated, they will just have paid leave. And also if they need to be at home for a family member or a child in their home, and our staff member has been vaccinated, it is just paid leave. They do not have to take their sick leave. If someone is not vaccinated and gets COVID, then it will be sick leave, or if they need to take the time away to be with a child at home and the staff member is not vaccinated, it is sick leave. So that's another incentive to be vaccinated.
I saw another question come in about a child who goes home symptomatic. I think the question is whether there would be a test available at the school, or does the child need to go to one of the Blue Ridge Health Department sites, or a doctor, or CVS?
We will not have the test available. Even when we start doing the testing that I mentioned earlier, it won't be to diagnose COVID with someone who is symptomatic at school. So we will be glad to give families the schedule for what we know of all of the testing sites. I have all of the testing sites through Blue Ridge till the end of September, and hopefully they'll keep giving us that, and we'll be glad to share that information with any family who wants to go get a test.
The URL for the letter that is sent home to families, just confirming, hey, we know your child is symptomatic. That letter contains the link to testing options. And then that information is also on our website. Again, just linking to Blue Ridge Health Department.
And does the vaccination rate of all staff include everyone, or is it just teachers?
It is everyone who has filled out the form so far. We've asked just this last week for it to be done, and we've asked for all of the principals and supervisors to make sure everybody does go into it to do it. So right at this moment, it's not everyone, but it is open to all positions. So we've got clerical, we've got nurses, we've got custodians. Everyone is a part of this survey. Administrators, teachers, everyone.
And I know that I've seen student teachers. I've sent the link to student teachers, folks like that. The intent is to figure out everybody who's in students' orbit and everybody who's in the staff's orbit.
I will say for any staff members who are going to need to submit to the weekly testing, it is going to be a very good idea, if they're not already a member of UVA's MyChart, where you can get test results, to join that, because Blue Ridge is going to start, for any of the testing that they do, it will be, the lab work will be at UVA, and the results will come back via MyChart. So people need to sign up with MyChart with their full driver's license legal name, so that when the test results come back, they'll have an easier way to give us that documentation.
And you can also do the MyChart piece through Martha Jefferson, if that's also where you go to get your testing. So in the time we have left, can Dr. Baptist, you and Kim just say briefly, how can families help the school division with their safety plan? Or, just a couple of reminders. You've shared a lot of information, but what is it that you'd like to leave them with, and how, with all the things that the school division is trying to do, what can the families do to help you with this?
Get family members vaccinated, wear masks, and keep us informed of any issues that we might need to know. So the communication are the three things that I would begin with recommending.
Dr. Baptist nailed it. The only thing I would add is the self-screening. Please, be honest with yourself and your kid and your family. That honest and real self-screening, taking that time and thinking about that and the importance of that, because it really does take us all working together to keep our community safe, and that of course includes our students. The good news is we can do this. I mean, we have proven we can do this, and so it's we're excited to have all the students coming back and And we got this. And that's what we all got to remember. We got this if we work together.
Yeah. Charlene, I did kind of skim down some of the questions and noticed that some people felt like our answers were kind of general. There's still a lot that's being decided. So when we talk about, what are the percentages that we would need to have for making closing decisions, we need to get into this, get going, and then work on it. So we're not trying to be evasive. We're just trying to make sure that we are following the current guidance and we'll do what we believe is the best thing for all of our families and our staff, as we know. So I don't want to set a number at this point and then find out that's off base, but we're being very aware and we'll monitor very, very closely. And I know our school board and all of our administration will make sure we're doing the best thing that we can.
And just to add to Dr. Baptist's comment, again, schools are mandated to be open now. It's not local decision whether or not we're open. And I believe that decision to close actually rests with the health department, not us.
Yes.
Ultimately, it would rest with the health department.
And given how information heavy this particular conversation has been and how it will continue to be, will there be an opportunity for another one of these sessions to give folks a chance to submit questions and just become as more informed as much as possible about what the school division is trying to do?
Yes, we're partnering with the community. So what questions are out there that we can try to answer or get answers to? I can only speak for myself. I know we're willing to do that and would be glad to.
And Beth, I was just going to say, you want to tell folks where to go online to?
That's exactly right. I believe there's probably been a crack at almost every answer that we've had, the question that we've had here today on that page called charlottesvilleschools.org/return-to-learn. And honestly, Amanda, my colleague Amanda Corman and I would be happy to take suggestions for that page. If there's something on there that isn't clear, or like we had an issue earlier about outdoor masking that has now been updated that we haven't gotten it updated yet. So if any of my colleagues on the staff or any of the parents or community members listening tonight find something on that webpage that isn't in sync with what we've been talking about, or frankly isn't in sync with what the latest guidance is coming out of the CDC, I hope you would email Amanda Corman or me so that we can get that page as useful and as accurate and as helpful as possible.
And honestly, some of that thinking about masking outdoors, I know our conversations earlier in the summer before the Delta variant started to emerge the way it has, it was different. We had planned and hoped that that our students could be entirely unmasked outdoors, and that was in line with what the CDC actually is still saying. But I think acknowledging what's going on with the Delta variant and so forth, and almost everything we put out comes with that tag, subject to change. And that's true with the screenings when students arrive. And I know that's challenging for all of us. We wish we could make decisions, believe me, and that they would just be good for at least 6 months. But we haven't even had that luxury for some time. We have to be fairly fluid in responding to what the needs are and what makes sense at any given time. So we hope families will continue to bear with us as we all navigate this together.
Kim, I'll take 6 weeks if we can't have 6 months.
So would I.
Yeah.
May I jump in real quickly?
Yes, go ahead, Lisa.
Yeah, so I, again, just want to thank everybody. I mean, I've seen a lot of questions coming in through the Q&A. And as the school board, want to acknowledge that we get a lot of emails and questions from community members. I want to acknowledge that we are receiving those. I'm doing my best to respond based on what we have set up as a school division. And like somebody had asked, I mean, we hope to have a repeat forum like this to update. And I think the repetition of these questions, we are all supportive of taking the same question over and over again, because we acknowledge and realize that people are engaged and checking in at different points along the way. So please don't hesitate to continue to ask if you have concerns. If anything is confusing or there's inconsistencies, we will do our best to address that, to explain why and or to fix things. I mean, we are all learning and doing our best. And again, our hopes, and our primary goal is to keep everybody healthy and happy and safe. And we look forward to seeing everybody in the building. So thank you, everybody. And that's all I have to say for now. Thanks.
Well, as a parent, I appreciate this opportunity. So thank you all for your continued support of the safety, and everyone, please reach out with your questions to your building staff, to the division staff, and to the school board. So thank you all, and be safe.
The last thing I want to say is just thank you to Beth, thank you to Kim, thank you to Lisa for your time today, and thanks especially to Charlene for agreeing to moderate our conversation today.
Thank you.
Thank you all.